This process of migraine explains the many different symptoms people experience during different attacks of headache. Most people realize or experience multiple presentations in their headaches. They have some headaches that they may think of as tension headaches. Others may be considered sinus headaches. There are little migraines and big migraines. And then there's that killer migraine, the big attack of migraine. If you think about this process of migraine, it is important to realize it can be stopped at any point in its evolution. If it is stopped before it goes all the way to become a full-blown migraine, the headache may seem to be a completely different type of headache. In this picture, we have now turned this model of migraine into a curve. Think about it in the whole process of migraine as described in this video. If we were to look at all of the symptoms that a person might experience, that would be a full-blown migraine. But again, not every migraine goes to that complete extent. If the migraine didn't go quite that far, it would become a less severe migraine. You know, perhaps a migraine attack that we are uncomfortable with, that impairs our function but doesn't make us go home from work or avoid family. If we go back a little further in that process, we may get a headache that is just sort of a dull, steady headache that may not be associated with things like nausea or light or sound sensitivity. And this, of course, would be looked at as a tension headache. And finally, sometimes there's just a change in the brain chemistry that occurs where people may have periods of irritability or fatigue or crave certain foods. If the migraine process gets corrected before the next stage unfolds, we may just call it a bad day. The important thing is to recognize that there is a clinical spectrum of headache types that can occur and be defined in this migraine process. It's still migraine. The earlier a person can effectively intervene in this process, the more effective they will be at stopping it and returning to their full and active function. Of course, we cannot predict the headaches that will develop into a bad migraine. That is where it becomes critical to listen carefully to your body and teach yourself to define a